DePaul Hospital does more than 120,000 diagnostic x-rays a year, and hundreds of thousands more are done at other area hospitals, as well as in doctors' and dentists' offices. Surprisingly enough, there are virtually no government regulations concerning x-ray equipment, x-ray technicians, patient exposure levels, and operating procedures. The Food and Drug Administration surveyed Washington area equipment, which hadn't been calibrated in years, and in some cases found it to emit radiation more than 5 times the federal safety standard. The director of the FDA Radiological Health Bureau, John Vilforth, says patients are getting zapped. But radiation physicist Jim Hancock says the equipment is safe if it's calibrated, as it is in most area hospitals, and if the technicians have been certified by the American Registry of Radiologists, which is also standard procedure in local hospitals. But that's typically not the case in doctors' and dentist offices, and Hancock says that could be dangerous.
There's always a chance that any machine, as complicated as an x-ray machine, will have some fault in it. An operator, a technologist who has been trained, will spot this problem very quickly and will report it to the radiologist. Someone who is not trained in this may well use the machine in an inappropriate manner.
According to Hancock, patients should ask doctors and dentists when their x-ray machines were last calibrated, what kind of training they have, and if the x-ray is really necessary. He also says he calibrates his family's dentist's x-ray machine before he sits in the chair. Would you submit to an x-ray under a machine that hasn't been calibrated and by a technician that hasn't had proper training?
Not likely.
Mike Deason, Area 10 Eyewitness News, Norfolk.